Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today I have several questions related to Obsessive Compulsive Disorder, OCD. Can I talk about contamination-related OCD? How is this type of OCD affected by actual increases in the risk of contamination? And would an actual threat make presentations of this disorder worse or result in more people developing this disorder? For example, the coronavirus pandemic. How would that affect things? Contamination-related OCD is sometimes called contamination-type OCD. I will refer to it as COCD. It starts with the idea of contamination fear. This is an intense and persistent feeling of having been endangered, infected, polluted, or dirtied as a result of direct or indirect contact with a person, place, or object perceived to be harmful, impure, infectious, soiled, or dirty. So as we can see, contamination can come from a variety of places in a variety of forms. COCD is a type of OCD that prominently features contamination fear. Therefore, it is characterized by obsessions, these are recurrent persistent thoughts, about contamination and disease threats, and subsequent compulsions, which are repetitive behaviors, like avoidance behaviors, cleaning or washing, or mental acts that can counteract those obsessions. So with OCD, we see these obsessions, and the person responds with the compulsions. And in theory, the compulsions make the obsessions go away or reduce how harmful they are, reduce how much anxiety they cause. Of course, in reality, we know that it tends to run in vicious cycles, where there are obsessions, compulsions, and then we see the obsessions again. Now, interestingly, OCD doesn't technically have any subtypes. The fear of contamination is simply one way we see OCD manifest. Often people who have obsessions about contamination also have obsessions about other areas. So I may refer to contamination OCD as a subtype or a type of OCD, but again, it's important to remember that this is not recognized in the DSM as an official subtype. So if somebody had it, they would just be diagnosed with OCD, and the types of obsessions and compulsions they have would be described as part of that diagnosis. Now, even though it's not a subtype, it is still a real construct. COCD is popular in the research literature, like it's an area that's studied, and it's one of the most common expressions of OCD. So now I'll take a look at some key factors associated with COCD. The first factor is attentional bias. This has been studied quite a bit in the research literature. With this type of OCD, we would see this manifest as a tendency to attend to situations or stimuli that are contaminated and threatening. So the theory here is that attentional bias maintains the disorder. An individual with this type of OCD pays attention to threatening stimuli. This leads to obsessions, which in turn increase the amount of compulsions that are used to reduce the threat. Studies have shown that individuals with contamination OCD direct more attention toward contamination-related words and have trouble disengaging from contamination-related stimuli. The next factor is disgust. With COCD, we see a strong association with the emotion of disgust, one of these 6 basic emotions. Another way we can think about this type of OCD is that it's characterized by an emotional dysregulation of the disgust emotion. This is called disgust propensity. This refers to individual differences in the perceived frequency and intensity of experiencing disgust. It is a personality trait that has been implicated in the development and maintenance of contamination OCD symptoms. Now, disgust is different than fear. Sometimes these two emotions are really confused. Disgust appraisals are focused on the threat of contamination. Fear is focused on the threat of danger. Often when working with people with COCD, they are really more focused on the contamination. They're not typically that frightened, right? So it's kind of an interesting expression of disgust and usually kind of a minimal expression of fear. Although, of course, sometimes we do see intense fear as well. But there doesn't have to be. Somebody can have a dysregulation of disgust and little fear and still have COCD. This is kind of conceptualized like depression can feature a dysregulation of sadness. Mania can feature a dysregulation of happiness. Antisocial personality disorder or intermittent explosive disorder can feature dysregulation of anger. Generalized anxiety disorder, we could see there a dysregulation of fear. And with post-traumatic stress disorder, we could see a dysregulation of surprise. Now, of course, there is much more to all those disorders that I just mentioned other than just the one aspect, the dysregulation of an emotion. But that's part of those disorders. And we think this dysregulation of disgust is a key part of COCD. For the next factor, we have cognitive distortions. We see many different types of cognitive distortions at work with contamination type OCD. For example, we see a construct referred to as the law of contagion, a belief that suggests that if somebody is in contact with a potential contaminant, they are always going to be contaminated. It's also referred to as the implausible chain of contagion. To illustrate this point, we see this research study that involved people with COCD and people who were found to be not anxious, right? So we see these two groups. And the individuals in the study, the participants, were asked to select the most contaminated object in the building. So they did that, and the researcher took a pencil and rubbed it against that object. So at this stage, the participants rated how contaminated that pencil was, how much contamination-related ideation did they have. Then the pencil was rubbed against another pencil, right? And they were asked to rate the contamination ideation, and this was done with 12 pencils, right? So as one pencil touches the other, and that pencil touches the next one, and on, we know that the level of contamination would likely drop quite a bit, which of course in the non-anxious people, that's what we saw. There was almost a 100% reduction in contamination ideation. For the people with COCD, the contamination ideation reduced by 40%. So a marked and statistically significant difference between how those groups see the transfer of contamination. Another factor is the overestimation of danger from contamination. So this would be where one was actually contaminated. Now, not all contaminants result in severe consequences like death, but somebody with contamination type OCD would believe that they have a much greater chance of severe harm if they were infected by some sort of contaminant. The last factor I'll look at here in terms of COCD is referred to as the Looming vulnerability model of anxiety, and it applies to COCD in a particular way. We see this idea that the growth rate of an illness is continually increasing, right? So germs are spreading, the threat is not static, it's not leveling off or declining, right? Always on the rise. Like contaminants can move on their own, and again, they always get worse. This is very pronounced with COCD. Now, all these factors are present in subclinical contamination type OCD as well. So a clinical presentation would normally require, or indicates at least, treatment. A subclinical presentation is somebody who doesn't really have clinically significant distress. It's not really bothering them enough to necessitate or warrant treatment. But interestingly, both groups, people with subclinical and clinical OCD, again, have these different factors. We see the law of contagion and the looming vulnerability model of anxiety and these other factors with these different groups. So how does this play out in a situation where the threat is real? For example, a pandemic. What happens to individuals with COCD and subclinical COCD? Well, there are a few different responses that can happen here. Well, the individual could pay more attention to news that seems threatening and ignore reports that are encouraging. And if they saw reports that are encouraging, it won't balance out the negative reports. So they could see one report saying something indicating a danger, and this would outweigh 10 reports that have good news. We also see a poor understanding of how illness spreads. So here's an example that I've seen. You see an individual with OCD. Pictures a man with an illness. This man's wearing a shirt. This man takes his shirt off and throws it onto a doormat of a random house. The owner of that house places it in a sealed container and places that container in the trunk of his car. The belief in the situation would be that everybody that car drives by would become infected. So the owner of that doormat, who put it in his car, he drives around, just drives by people in other cars, everybody gets the illness. Even if that car is taken to a junkyard and dropped off and no one is there, the pathogen will somehow escape the sealed container and open the trunk, then wander off into a nearby community. Now, certainly some pathogens are more contagious than others, but that would be an incredible amount of contagiousness. And of course, they don't have those types of mobility capabilities. For example, opening the trunk of a car from the inside. Now, I know there are interior release handles in many modern cars, but still, pathogens don't have hands, right? So we run into a problem there in terms of the logic. So we see a real lack of insight in addition to a lack of understanding about how these things work. Essentially, the person believes that the world is permanently contaminated. Another possible response, we see this assumption that the illness will become more dangerous over time. Now, of course, this is true some of the time. Illnesses can certainly become more dangerous, progressively dangerous, but at other times, situations improve. So with COCD, we only see this in the one direction. So with all this in mind, does that mean that somebody with contamination type OCD will become worse during these types of stressful times? Interestingly, in my experience, no. They already have clinically significant distress. They're already afraid of contamination when there is not a large threat. The presence of an actual threat doesn't change the presentation too much. Now, it might change the topic that's being discussed. Like, certainly, it would make sense that that would become the topic talked about in the counseling session. But I don't think it actually leads to a dramatic worsening of symptoms in many cases. So what about somebody with a subclinical presentation? Well, this is a different story. Here, someone again has a presentation that doesn't quite rise to the level of clinically significant distress. I think that what happens here during times of a real threat would be that someone with a subclinical presentation could actually move into the realm of clinical. Perhaps the absence of an actual threat is actually what was keeping the symptoms below the clinical level. So I think here there is a risk of somebody developing the disorder, the conversion of a subclinical presentation into a clinical presentation of COCD. So if somebody has COCD or a subclinical presentation of the disorder, what should they do? Well, of course, seeking counseling is always a good idea. Counseling is available face-to-face and in many areas online. The risk of contamination can be controlled fairly well in a face-to-face environment, depending on what type of pathogen that we're talking about. But there really is no risk of contamination through online therapy. Now, exposure and response prevention and cognitive behavioral therapy are typically somewhat effective for this type of OCD and for treating OCD in general. So these are two fairly common therapies we see being used. So how about this idea that people should avoid consuming too much information about the news, about what's going on with different pathogens? I think this advice makes sense. When you find out what you need to know to stay safe, it's not necessarily helpful to dwell on the topic too long. I think as important, though, would be making sure that you're getting accurate information. Misinformation is never useful, regardless of whether somebody has a tendency toward OCD or not. Now, I know whenever I talk about topics like obsessive compulsive disorder, there will be a variety of opinions. Please put any opinions and thoughts in the comments section. They always generate an interesting dialogue. As always, I hope you found my analysis of this topic to be interesting. Thanks for watching.